Dr. Harvey.
Hello, Meredith.
Nice to meet you. I'm Meredith. I'm the dietitian, and
nice
I'm
to
going to
meet
teach
you
you how to use your new feeding tube. In order to use your tube, you'll need your feeding tube cans that are usually sent home with you or delivered to your house. You'll need a pump bag, and you'll need a cup of warm water, and you'll need your syringes for that. So
Okay.
we have all of that sitting over here, and we'll get started. The first thing you'll do is you'll open up the bag. You get a new bag every day, so you don't have to reuse the bag. And this bag will hang from your IV pole.
Okay.
I usually hang it a little bit further away. And I tend to just open up each can one at a time and pour it into the top of the bag.
Yummy.
It looks delicious, doesn't it? The bag will cap if you press tightly, and it will seal. We will start with turning on the pump. You hold the power button right here. We'll start with new settings, although you can keep your settings if they're the same every night. The first thing we'll want to do is we'll want to load the set. So you'll look at your tubing, and there's a stretchy part of the tubing right here. This is the part that you want to find. This attaches to the side. It loads just like this into the pump from the left to the right. Close the door. And the pump will know when it's set correctly. So now we have your feeding is in the bag, and it's going to run through this tubing. I usually keep the cap on until right before we start. The top of your pump will say set loaded. The first thing you'll want to do is you prime your pump. It's the top button right here. Auto prime is a great setting because it will prime almost all of the tubing so you don't feed yourself any air. So as you can see, the feed will start running through the tubing.
Seems pretty easy so far.
It is. You'll be great. It will prime almost to the end, but as you can see, you may have some tubing that doesn't have feed in it yet. For this, you can use the hold to prime feed button, which is the second from the bottom. All right, this can remain capped for now. And you press done. Now, before we feed, we're ready, but what's the first thing we do is we flush water.
Correct.
So I'm going to bring some warm water, and you'll want to draw up at least one syringe full of water. 60 milliliters. To release any air, you can turn the syringe upright, and then we'll flush it through.
Okay.
All right, so we'll attach this to the end, and we'll push the Lopez valve to on.
Yes, I'm noticing that there are 4 different spots
Yes.
on the valve, and one is off, and the other 3 don't have anything on them. Is that significant?
It is. So these arrows show you which way it runs.
Okay.
And the arrows, you want the arrows running up and down
Okay.
in order to feed. When you
Alright.
want your tube off so that nothing comes in or out, you push the off to the top.
So in other words, if it was like that, nothing would go down.
Nothing could go through.
Okay, so we'll
But
turn it
now-
on the on position.
Correct. Excellent. And then this will flush through. And you might have to put some pressure to be able to flush the water, and just slow and steady. But your small intestine can absorb water very quickly.
Right.
It can't absorb food very quickly.
Didn't feel anything.
Wonderful. A
Except
little
the
bit of
drip.
luck. Excellent. So now we're ready for a night of tube feeds. You'll take this tip, you may have an adapter, and you'll push it into the end of the Lopez valve, and you'll keep it on the on setting.
Oh, it's on.
So we'll go to adjust feed. The feed rate is the top button. It has 3 different options and 3 different arrows. This one will be at 60 milliliters an hour, so it's the middle arrow. We'll adjust that to 60, and this is individual milliliters. Press enter, and that will give us the rate. VTBD is an optional setting, and it's the volume to be delivered. You can set it for 1,000 if you're running a pump bag. The next step is just to run.
Wow, that tastes good.
Excellent! We like the flavor of it. So if you need to go to the bathroom or if you need to move around, you don't have to roll this with you. You can, but you don't have to, because there's a hold setting on the pump. So the hold button is right here, and all you have to do is hold, and then you grab the cap, and you can disconnect yourself.
I see.
So if we need to hold it, we can disconnect and then just recap. Then you can run when you go back to your place. When you're finished with your feeds, you can see the history on the pump, so it shows you how much you fed. You can discard your bag, so you don't need that anymore, and then you can press done. And then the most important thing in keeping your tube clean and clear is that you need to draw up another 2 to 4 ounces of water when you're finished.
You want to eliminate anything that's food that's in there.
Absolutely. We don't want to see any food. And then we'll turn that to off. And you are set for the day.
Beautiful. Thank you.
Wonderful.